You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. Igor Kaplansky. Dr. Kaplansky is the founder of Dentistry by Dr. Kaplansky in Gasport, New York. He grew up in Russia, and after receiving his dental degree, he was accepted into the International Dentist Program at the University at Buffalo School of Dental Medicine. He graduated cum laude in 1998 with a Doctor of Dental Surgery degree and continued as a resident in the Advanced General Dentistry Program at Buffalo. Since 1999, Dr. Kaplansky has been practicing family dentistry with a special interest in orthodontics and dental implants. He has been recognized with prestigious fellowship awards from the Academy of General Dentistry and the International Congress of Oral Implantologists. Dr. Kaplansky is widely considered to be one of the top dentists in the country, and he is also a contributing member of our national network of industry professionals. And today we're going to talk about a very important topic, kids' dental health. Hello, Dr. Kaplansky. How are you today?
Good morning, Liz. Good to be here.
Well, thanks for joining me. So what is the best age for kids to start seeing a dentist?
That's a great question. A lot of times parents are a bit confused and they don't know what would be the best time to bring their children to the dentist. The American Dental Association recommends for children to be seen by a dentist within 6 months of the eruption of the first baby tooth. So usually it's somewhere around 1 year or 12 months of age. We normally see kids a little bit later, say around two or three, to start routine maintenance, cleaning, checkups, this kind of stuff. But the initial visit when kids are really young is more important for the parents. It is geared more towards educating parents on what to do and what not to do with baby's teeth and how to make sure that there is no cavities when they finally do bring them in for maintenance at the age of 2 or 3.
And why are baby teeth important?
Baby teeth are very important for many reasons. Some are obvious and very clear to parents, and some are not. So the obvious reasons are certainly chewing, right? Babies need to chew. Kids need to eat. Speech development is another important factor. Baby teeth are important for. And then one other one that usually gets kind of forgotten is baby teeth maintain room in the jaw for the permanent teeth. So unfortunately, sometimes we see this kind of attitude among parents is that, it's just a baby tooth. It's okay for it to, if it, decays a little bit or falls out, we don't need to take care of it. It's just going to fall out anyways. Well, the problem with this is the dental arch, the jaw is going to develop improperly. It will collapse, and the permanent tooth will not have enough room to escape. So eventually these children see more orthodontic problems and spend more time with braces.
And do kids have to wait for all their adult teeth to grow in before they start orthodontic treatment?
Excellent question. There's different types of malocclusions or bad bites. Some are treated when all the adult teeth come in. Some can be treated earlier. We usually evaluate children every 6 months as they come through the practice for their cleanings and checkups. And we advise parents on what the best time would be for that particular child to start orthodontic treatment. But treatment can be started earlier in some cases, and it's beneficial to start it in what's called mixed dentition when there's some baby teeth present still. And like I said, the others, it's best to wait for all the baby teeth to fall out first.
And can kids get cavities from not flossing, even if they brush their teeth like twice a day?
Absolutely. Baby teeth are just like adult teeth as far as their vulnerability to decay. And if plaque is not removed in between the teeth, which is what flossing does, you can get a cavity in the baby tooth between the teeth. And unfortunately, again, it's on parents most of the time. And if parents don't emphasize the importance of flossing for their children, kids obviously not going to floss on their own, and then they end up having cavities between the teeth. If these not diagnosed soon enough or early enough, they turn into larger cavities. The arch will then collapse because teeth get smaller in their width, and then permanent teeth have a hard time erupting. So it's not just about cavities and bad-looking teeth or pain or abscess. It's also all related to orthodontics as well.
And lastly, what advice do you have for parents of kids who are nervous about dental visits?
The best thing to do is to prepare your children a little bit. Explain to them. It follows this same kind of mantra of tell, show, do, which is what we all learn in professional school. That's how we approach children when they come for the appointment. We explain to them what we're going to do. We show them a lot of times what we're going to do, and then we do it. So if parents could prepare their children a little bit and explain what to expect and not scare them in the process, then their initial visit is usually a pleasant one, and it's all just about basically brushing their teeth with a professional toothbrush. We just clean their teeth, everybody's smiling, happy, and they all go home happy. But unfortunately, sometimes we witness parents scare their children with the dentist. If you don't do this, I'm going to take you to the dentist. Or if you don't do this, they're going to drill your tooth. This is what scares kids. Right. This is what sets up this whole vicious circle of, crying and bad emotions. So just that'd be the best thing to do is not to do this.
Okay. Well, thank you for your help, Dr. Kaplansky. We know you're really busy, so just want to say thank you for your time today.
Oh, always. It was always a pleasure.
And for our listeners across the country, if you are interested in speaking with Dr. Igor Kaplansky, you can either go online to www.drkaplansky.com or call 716-772-7500 to schedule an appointment. On behalf of our entire team, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.